Hey guys, it's Diabetes Diva. It's been so long since I posted, but I've been dying to tell about my second pregnancy because since I had my first child, it's been a couple years now and I got pregnant again and now I have another boy. And so I feel like I learned so much going through it the first time, and going through it the second time just really solidified, what really worked and what didn't, and also just cleared up some things that I, was confused about the first time. So if you've watched my first pregnancy story, then you'll know that I was super diligent, and even some of my carb counting videos, I measured everything. I was incredibly diligent about doing everything I could to keep my blood sugars under control. And now, of course, with my second child, I was still very diligent, but I had a little toddler to chase around, my first child, and so I did not have the time to measure out everything and just be completely robotic about it like I was the first time. And so that being said, I did feel like I had more spikes, a little bit more up and downs with my second child, but overall I still have pretty good control, and I don't feel like, there's so many variables anyway when you're pregnant. I feel like your blood sugars are just changing all the time just because your body is changing all the time. And so I felt like it was still okay just because there's so much fluctuation anyway, just as long as you do your best and, just do your best to count and estimating the best you can, and just chasing after those highs as fast as you can when you see your blood sugar going up, then I feel like it turns out okay. And it did turn out great. I have a super healthy little 14-month-old boy right now, and he is the cutest and the best, and he's talking up a storm and walking and everything, and I just know that it was all worth it. Both of them, it's completely worth it. And one thing that I wanted to mention, one big dilemma I had with my first pregnancy, with my first son, is that at the end they stuck me in the hospital at 36 weeks because my insulin needs went down a little bit and my blood sugars were going a little bit more low than normal. And there is a risk of placenta abruption in the end for type 1 diabetics. And so they put me in the hospital and they said, we want to monitor you. And I felt like it was a huge waste of time because I was literally on a couch in the hospital, in a hospital room. I wasn't even in a bed, and they weren't really doing anything. I was just kind of hanging out until they could take the baby at 38 weeks. And so because here in Texas, then there's a law, I don't know if this is the same everywhere, but you can't take a baby before 38 weeks without a medical reason, and there really wasn't a good medical reason at this point. So anyway, that was kind of stressful for me because I was just hanging out in the hospital, and then at 38 weeks, I was induced with a failed induction, and I had a C-section. And so I just felt like, I don't know, I was just really unsure if I should have been induced at 38 weeks. I had a lot of questions. And so then the second time around, I did do some more research, and there's a lot of moms out there who do go to full term, like 40 weeks, even 41 weeks, who don't induce at all. And they have perfectly healthy babies, and they're type 1s. And, there's not a lot of research on it, honestly, for type 1s who keep their blood sugars in really good control. There's just not a lot of research basically on the outcomes of those babies. Most of the research is done with type 1 diabetics in the A1C of 7 or so range, and so that's just a little bit higher, and there is definitely more risk if the A1C and blood sugars are overall higher. So anyway, so my A1Cs were really good, and I was overall very much in range. And so I did, I talked to my doctor, and we decided on 39 weeks. And he was a little bit nervous about it, honestly, and I was a little bit nervous because I'd never done, I'd never gone to 39 weeks before. But same as last time, at 36 weeks, just like my first pregnancy, my insulin needs did drop a little bit. So that same thing. And they didn't drop drastically. I think, if your insulin needs drop drastically, my endocrinologist said that usually does mean placenta abruption. But mine just went down a little bit, just the same as the first time, and that is normal for me. I realized, nothing was wrong this time, and that same exact thing happened. And I did wait till 39 weeks, and I had a planned C-section for the second time. And everything was great. He was born with a normal blood sugar, and, the C-section went fine, and I healed fine, and, it is still major surgery, but I had a 9-pound, 3-ounce baby, so he was definitely on the bigger side, but I don't know if that was because of my blood sugars or not. He's just a big guy anyway. He's been just tall, he still is really tall. And so anyway, I thought everything turned out fine, and I was just glad to know that my body did naturally decrease the insulin needs at the very end. That was just a good thing for me to personally know. And I think a lot of women, from what I've read, I think that's pretty normal actually, just a slight decrease. And remember, of course, this is not medical advice, but a really, really big decrease in insulin would mean more significant problems. So it was, it was a little bit stressful having a toddler to run after the second time around while I was pregnant, but I just did the best I can, and everything turned out great. And once again, I just used my continuous glucose monitor the whole time and my insulin pump, and it was worth it. And I did my best, and there were stressful nights when I was walking around trying to get my blood sugar down, and everything turned out fine. So I'm a happy type 1 diabetic mom, and I did learn a lot the second time through. And so I hope that helps you guys who are pregnant right now and just who are scared or wondering what's going to happen. Message me with your stories and tell me what you're going through, because I know that it's hard and that it's scary, and I have been there. So anyway, hope you have a great day. Bye.